Good afternoon, everyone, and a very warm welcome to today's CMM Insight Webinar in association with the National Care Forum. Thank you for joining us today for an update on the future of adult social care regulation. We're really pleased to welcome Chris Badger, Chief Inspector of Adult Social Care and Integrated Care at CQC, alongside Rowena Marshall, Deputy Director of Adult Social Care. Also joining us are some wonderful colleagues from the sector, and as always, the session will be expertly chaired by Liz Jones, Deputy CEO and Policy Director at the National Care Forum. We really encourage you to ask questions throughout this session, which you can do by using the Q&A button at the bottom of the screen. Please do bear with us as we respond to those, and any that we don't get to today, we'll do our very best to answer directly after this session. This webinar will be recorded and will be available to view on the CMM website in the coming days. Today's webinar has been kindly supported by Rowena. So before I hand over to Liz, I'd like to welcome Philip Chapman, Head of Partnerships, just to say a few words.
Hi everyone, thanks for joining us. I'm Phil Chapman, the Head of Partnerships at Rowena. If you haven't already heard of us, Rowena has been supporting care services since 1986, with HR, health and safety, and tailored information for care providers. In the last 40 years, the face of the care regulation and inspection has significantly evolved, and so have we, moving from loose leaf binders to today's digital product, which allows you to search for the answers you need quickly and easily. With our expertise and experience in the care sector, we aim to make busy and stressful jobs of care managers easier by providing the grounding for compliance work. This means the best documentation, tools and training resources at your fingertips, so you can have a greater focus on ensuring people are receiving the high quality care they deserve. We've always appreciated the challenges faced by busy carers, and our expert contributors have gained first-hand experience as care managers, nurses and trainers in social care. Looking to the future and ensuring that we're fully best care services for the next 40 years is really important to us, which is why we're delighted to be sponsoring today's webinar on the future of adult social care regulation. If you'd like to find out more about how we can help and why we're the only one-stop shop for care providers, please click on the link that's been provided. Thank you.
Without further ado, I'd like to hand over to Liz, along with our speakers, who will introduce themselves and get things started. Thank you so much, Liz.
Thank you, Lisa. And thank you, Rowena. Welcome, everybody. Thank you so much for joining us today. As Lisa said, this is one of a series of webinars we do with Care Management Matters, and one of our regular topics is regulation. So we thought it would be a timely moment to have a session with our colleagues from the CQC and some of our members to contemplate the future of adult social care regulation. I'm Liz Jones. I'm the Deputy CEO and Policy Director at the National Care Forum, and we're a membership organisation for not-for-profit providers of care and support services. So I'm going to ask our all of our speakers to introduce themselves, and I'm also then going to remind you all about the Q&A, and then we'll get going. So over to our CQC colleagues first. Chris, would you like to introduce yourself? I suspect everybody knows you, but you know.
Hi everyone, I'm Chris Badger, Chief Inspector of Adult Social Care. Really glad to be here today. Nice to meet you all.
Thank you, and thanks for squeezing us into your busy schedule. Ro?
Good afternoon, everyone. Lovely to be here. I'm Rowena Marshall. You can call me Ro. I'm the Deputy Director of Policy for Adult Social Care and Local Authority Assurance at CQC.
Thanks, Ro. I'll introduce my colleague, Honor.
Hi, everybody. I'm a Policy Research and Projects Officer at the National Care Forum with Liz.
Thanks, Honor. And then our colleagues from our members. So Dan G. Are you struggling to get off mute, Dan? Oh, no, there you are.
Good afternoon, everyone. I'm Dan Gower-Smith, and I'm the Chief Operations Officer for a charity that's called the Avenues Group, supporting adults of working age who have learning and autism.
And Dan R.
Hi Liz, hi everybody. I'm Dan Ryan. I'm Executive Director of Care at Anchor, where I've been just for a few months now, so finding my way in and getting to know our CQC colleagues. At Anchor, we support older people across England through specialist housing and care, and that includes about 120 care homes. So I've got a strong interest in the subject.
Thank you. And if you're wondering, yes, we did decide to invite two people called Dan, just so we could have the fun of them working out which one we were referring to. We were hoping to be joined by our colleague Amanda from the Together Trust as well, but she doesn't seem to have managed to get on. So she may join us in a little while. We've got another colleague from the CQC, Lizzie Hardy, who's going to be helping us with any of the Q&A and makes a lot of the magic happen generally with CQC stuff. So thanks to Lizzie for joining us. And just to remind us that the Q&A function is the best place to put your questions. We can try and answer them live, which we will do as we go through, and we can also put written answers in if they're kind of technical or logistics or kind of factual things that Lizzie or Ro or Chris can answer on the spot. It's really important that you ask the questions that you've got. If we don't have time to look at all of them while we're live on the webinar, we will do a follow-up Q&A that goes on to the website. And of course, these webinars are always recorded and posted on the CMM website afterwards. So you can always have a look back to see both the session and the Q&A. So we're going to get started, and we've got what have we got? We've got till 2:30, so an hour and 20, where we'll hear from Chris and Ro. Honor's going to talk to us then about the work with the Care Provider Alliance that our colleagues across the Care Provider Alliance have been supporting in terms of CQC work, and then we're going to get into a bit of discussion with Dan and Dan. So over to you, Chris and Ro.
Thanks a lot. Thanks,
Technical ability here.
Lynn, thanks, Ro. There we go. Brilliant. Thanks a lot, Ro. Look, thanks, colleagues, for inviting me. And pleasure to be in front of so many adult social care colleagues. What I'm going to do is run through relatively quickly a few thoughts on where we are in terms of the future of adult social care regulation and some of the things we want to do in the short term, and some of which are slightly longer term in nature. But I thought we'd give you a quick overview of where we're at to inform the discussion later. So if we can move on one. I think it's important, and I've said before, my vision for the CQC as an adult social care regulator from my position as Chief Inspector of Adult Social Care is that my number one priority across all the areas that I'm responsible for really is that we need to be fulfilling our core purpose of doing more inspections more often. And there's a couple of reflections to say on that, which I'll talk about later about how we're going to do that. But on top of that has been the first decision I took really as Chief Inspector was to recalibrate how we were using and how we were prioritising inspections. So when I came into post, it was clear that our inspections were being prioritised primarily in response to risk that we were being made aware of, whether it be through safeguarding, through local authorities, or through informations of concern that we were receiving as a regulator. What I felt this missed was the inherent risk in old ratings. So that's a risk for care providers who are sitting on a rating that is out of date and may not reflect where they are now, but also crucially a risk to the public, because old ratings may give a misleading view to the public around how good or bad a care provider is, and they need to be timely and up to date. Now, a rating will always only be a moment in time, and inspection will only be a moment in time, but it's crucial that, you know, the more accurate and up to date they are, the better. And I'll talk a little bit about what we're doing later to increase those number of inspections, what that looks like. But also, I'm clear that as a regulator, we need to work in a certain way, and some of that means changing how we work. I really want to be a regulator that engages and works with co-producers and works with people who use services, their families, their carers, care providers, and local authorities. So we're only as good as how collaborative and thoughtful we are in that engagement as a regulator. And clearly, things like participating in today and the work that we've been really grateful for the Care Provider Alliance to do on our behalf, really, hopefully is indicative of that approach. Crucially, I want to rebuild the relationships between local CQ teams and providers. So we've moved back into sector teams. So there's dedicated adult social care teams from November in a given area, whereas previously they were doing hospital inspections, mental health inspections, primary care inspections. We've now got restored dedicated adult social care teams that work in regions and then work up to me. And over the course of the next month or two, and we'll talk a little bit about this later, we are going to look to re-establish lead inspectors for each care provider. So there's a named inspector that can build a relationship with providers, really, because I want to spot problems early, spot things that are going well, and tell everyone else about them so we can learn as a sector and improve. But make sure the first time we hear about an issue or a concern a provider may have is not when we do an inspection, but because, you know, we've actually had a conversation and we've tried to iron out issues ahead of them becoming a bigger problem. And that kind of proactive approach where we've got relationships between local teams and providers is something that providers have said they want to do. Colleagues who work in inspection teams want to do it too. So we're looking to put that back in place, and you'll see progress in that over the coming months. Clearly, we've now gone back into a sector specific set of teams. So all my senior managers are adult social care specialists, got a lot of experience in the sector, and I've come from an adult social care background, both as director of adult care. I've also had a variety of care companies work under my sort of stewardship, and have been about 15 years in the adult social care sector. Longer term, I do want to improve how we use data and insight and what we do, and I'll talk a little bit about that later. And I think importantly, it's important that the CQC, as the regulator, is a strong and credible advocate for adult social care, particularly as we go into things like the KC Commission and wider changes to the adult social care landscape. So we can move on. So just wanted to flag, I know colleagues will talk a little bit more about this later. As you'll know, we are consulting on our new adult social care framework. Previously, we had 34 quality statements in the single assessment framework. We've gone down to a specific adult social care framework, which I think is right because it recognises the specialisms in adult social care, and the consultation on this is currently open. And at the minute, here are the 24 key lines of inquiry, as we're proposing to call them now, that are out for consultation. I think there's still some room here where we can reduce some of that duplication. I'm really clear that we need to make this as effective and practical as possible, and my watchword is practical here. We need to use this to pick out what really matters to people in terms of their care, and that's, you know, is it personalised care and is it safe? How can we have an assessment framework that makes sure we get a really good understanding of that and some of the things around leadership that are really important, but doesn't duplicate and cause a lot of work for providers and a lot of work for the regulator. So how can we make sure this is as simple and clear as possible, and crucially links through to the regulations? The regulations haven't changed, but we're trying to make the assessment framework line up really clearly with the regulations and make that a far clearer and a more concise approach. And if we move on, just to illustrate that, and you can see this when you go through the consultation, a couple of things I just wanted to pull out here. We've got the key question level, which is that they haven't changed, the 5 key questions. We've kept I statements, which I think are really helpful because they really remind us around why this matters to people. So how does all this relate to the experience of someone that you are supporting in care? And that's really important. Key line of inquiry, Chloe, as opposed to quality statements. And you can see there an example there's assessing needs and what that means. And then crucially, ratings characteristics. And what that really is trying to do is to sort of try and be clear broadly what we'd expect to see for each of those key lines of inquiry for outstanding, good, requires improvement, or inadequate. Now, they're not fully comprehensive because we don't want to be so prescriptive that we dictating how care is provided. That will always be different in each different setting and for each individual, of course. But ratings characteristics is an attempt to try and demystify what we're looking at. This isn't an exam. It's not a test. This is about, these are broadly what we think outstanding would look like in a particular CLOE, so that both the teams inspecting and using the framework and those that are being inspected have a shared understanding of what's being looked for. And we hope that's a really important tool to help people improve and understand how they can achieve a really good rating to reflect the quality of services that they provide. If we move on one, please. So that's the future and where we're going on the assessment framework. It's clearly a big deal. We talked later about some of the opportunities people have got to get involved, but we're not going to wait for that to happen before making a number of other improvements that we need to make. So we know we need to get out and do more inspections more often. We did 400 in March, and in the last financial year we did about 55% more than the previous year, but it's still not enough. And I want us to be out and about more often, more regularly. So we're doing a few things that will help us do this. One of which is something that we've piloted and published our first report at the end of last week on, which is a return to good methodology. And that's something that we used to do, but really this is saying where a service is already rated as good, we haven't got any ongoing concerns from the intelligence we get, may not have seen a very big turnover, for example, of the registered manager. Is there a way that we can secure and re-secure our understanding of that service being good in a streamlined way that allows us to give a rating, but does it in a way that allows us to do that process more quickly, less intrusive for the care provider, and allows us to do that and get the report published really, really quickly. We've piloted that. Feedback so far has been really good. We look to use about 17 of the current quality statements when we do that. That's not, a million miles away from what we think the new assessment framework will be when we talked about there being 24 CLOE. So it's a bit of a precursor to the new assessment framework, if I'm honest. If we go into one of these providers and we suddenly think, oh, hang on, this is actually really outstanding, we'll of course do the full assessment. Or equally, if we go in, cross the threshold, look at what's going on and we're concerned that it would be potentially requires improvement, again, we would do the full inspection. But if we are confident that the provider remains good, we can do an inspection that we can deliver relatively quickly, efficiently for everyone, and then the rating is agreed, published, and we move on. Similarly, we're doing work on the length of the reports. I'm really conscious that the reports are quite long. In some cases, 8,000 to 9,000 words. That's a lot longer than an Ofsted report. So and our feedback from people that use care reports to make choice about care is they don't read much more than the summary, if I'm honest. So we're reflecting on whether the reports are the right length and whether they're accessible enough. So we're doing some work on that. And again, if we can make those more accessible, more probably concise, if I'm honest, we can probably get through more assessments and more inspections. And I think that's a trade-off that I'm willing to take. I think it's important that as the Chief Inspector, I've got greater regulatory oversight of what's happening across care. And I think you would all welcome more reports on a more timely basis. That might mean that the kind of length of those reports changes. Crucially, I think what we need to get right is the feedback to providers when we do an inspection. That's what drives improvement rather than the report itself. And I think we should, in our minds, think about those two things are slightly different. And I've talked about portfolio management. This is about rebuilding relationships on the ground between inspectors and care providers, which I think is really, really important, looking to roll that out by June. So a lot going on over the next couple of months. Again, all designed to make sure we're out and about more often, doing more inspections. So just quickly go on and I'll canter through the rest of this. So, we continue to undertake significant amounts of enforcement. I've just put in there really where we see the most enforcement themes and trains. Regulation 17 on good governance, safe care treatment, and 18 on staffing. You'd expect that. Still seeing, where providers we feel have sort of a pattern of issues, but the root cause tends to be the leadership within a care provider. That's not a surprise to you. And really on incidents where we're still seeing quite inconsistent practices, the extent to which incidents are being learnt from. And then just a couple of ones where, I'd expect some of these to be sort of basics that I think we can, collectively agree we'd want to sort out. Unsafe equipment use and planning. Again, some of that's, again, I would go around to the links through to Regulation 17 on governance and leadership. But an example where what I'd say some of the building blocks of good care are being missed, and that causes potentially significant risk, and we're having to enforce against that. But just thought it'd be helpful to share some of those themes. But if I move on, as important, if not more important, is really the outstanding practice we're seeing. We're seeing more outstanding practice since we've changed those priorities and going out to a different range of services, not just those that are presenting risk. Just brought out a couple of themes there. Crucially, person-centered excellence. So I talked about personalisation. Personalisation is the bedrock. In my role as Chief Inspector, that I see is the bedrock of quality care. And those services that are really going the extra mile to make services personalised to reflect the individual needs and aspirations of the people they support, and how creatively people are doing that is clearly outstanding practice. A lot of people using technology in a way that we think delivers outstanding practice. Not prescriptive about what that technology is, but if people can demonstrate how that's improving people's lives, then we welcome it. And I think we're also saying that where people are securing and looking to get recognition and accreditation for their colleagues and the staff working in care, and that sense of really appreciative leadership of the great work that people are doing on the ground in your teams, again, that's tends to be where we see really outstanding practice. We will be doing more in the autumn to really promote where we're seeing outstanding practice so people can learn from it. We're here to regulate, but really, ultimately, we're doing that because we want to see care improve. We want to see people learn from one another. I think that's something we've not always really done as well as we could have done in adult care, and we want to making sure that where we see outstanding care, we're shouting it from the rooftop so people can learn. Go on one. So just some tips really, which people have always said is quite useful to see about just, if you're having a CQC inspection and what you can do to be ready for those. I won't talk about all of those, but what I suppose I'll be really clear about is, where staff feel confident to talk to us. We notice that when we're on inspection, when I go on inspections, and I go on inspections myself, where staff have that confidence to speak to us and crucially tell us how they're supporting individuals and how they're personalising that support and how well they know them. That really comes across strongly to us, and that really is really, really important. I think it's important. Don't be shy about showing us good practice when you see it. If you've got an issue on the inspection as it goes along, raise it there and then, and don't wait. Would be my real tip around how to manage the inspection rather than what you're necessarily showing us. If you've got an issue, raise it immediately rather than later down the line, because it can get lost. So I think it's really important, if you've got any issues or you want a clarification on the process, say so now. I think it's also really important that anything that you talk to us about, you bring back to how it impacts positively on the people that support the service. I want to move to a position where we're talking less about procedures and policies. I kind of want to assume that they're in place, and more about what difference is it making to people you're supporting. And that's what I call the 80-20 rule. So 80% around how care is personalised, how people are supported, and 20% on more of the governance issues, and not the other way around. And I think to help us do that, which I think will help us really look for good, is to be clear in all that you do, is to say, okay, what? How does this make a difference to people you support? And I think it's important, and if you can do that, and ultimately those kind of things, and you'll have these slides, will help you make that as productive and constructive a process as possible. If we move on, just a couple of things then that we will be doing over the next few months that it's important to know about. We've got the survey on the assessment framework that closes on the 12th of June. We're going to have sector specific, so adult social care specific work with different groups, often quite specialist groups in different parts of the care sector throughout June. Lots of approach to get our new IT systems right. That'll be happening over the coming months, and that work's started. And we're going to be wanting to test the framework. Does it work in practice? And might look good on paper, but does it work for the people that need to use it as inspectors, and does it work for care providers? And we'll pilot this extensively to make sure we get it right. Similarly, doing some work to strengthen and test our registration process, and that work will be ongoing too, with a view then probably back end of the year, early next year, implementing the new assessment frameworks. What I would say is I want to get this right, so when we implement it, then I want to make sure we've done all the piloting and made sure it works with the IT system. I think the CQC's made mistakes before about not getting that right, so I'm clear that I'd rather get it right and it take a little bit longer than have a full start. So a couple of things that we're doing, just a QR code so you can feed back on the assessment framework yourself online. We do look at all of these. They come in, and I've already seen where they've come in already and had a look at what people are saying already. So please do take the opportunity to have a look. So some longer term things that we're doing, some shorter term things that we're working on, but hopefully you can see we're striving to put in a number of measures to position ourselves as a collaborative regulator, rebuild some of the trust that we know that has been lost, and ensure overall that we have a setup and a system that is designed to drive improvement in all that we do in adult care. And I know you'd all agree that that's a really important joint endeavour, and we want to play our part in doing that. So thanks a lot for your time.
Thank you, Chris, and thanks for those slides. Everybody loves the 10 top tips. And actually, I've got something to add to the list for Dan and Dan once we get chatting, which is thinking about preparing our staff for inspections. Quite an interesting debate, I think. And I can see there's some Q&A coming in, so we will have a look at those in a little while. But your reminder about the consultation is a nice segue into the next bit of contribution from my colleague Honor. So Honor has been well, remarkable actually in supporting the work of the Care Provider Alliance to bring together input from across the associations involved in that work, supporting the CQC. And we thought it was important to recognise the efforts of colleagues across the Alliance. So for those of you who don't know about the Care Provider Alliance, it's an umbrella grouping of trade bodies. So we're in it, Care England are in it, the Home Care Association are in it, National Care Association. Now I'm going to have to try and remember everybody. Honor will be able to remind me. We will have a list somewhere of everyone who's been taking part in this piece of work. So do you want to just provide a bit of the context, Honor, into the work that the Care Provider Alliance has been doing to support the CQC's improvement work?
Yes, I can do. Thank you, Liz. I should have some slides just coming up now. Lovely, thank you. Yes, so as we've said, I am a policy research and projects officer, normally at the NCF, but today I'm very much here with my CPA hat on. So some brief context to the work that we've been doing. I won't go into this in too much detail because I think everybody will know. But in 2014, we had the Penny Dash, 2024 even, we had the Penny Dash review into the operational effectiveness of the CQC, which was ordered by DHSC. And then from that came various other reviews, including a review in 2025 into the single assessment framework specifically, completed by Professor Sir Mike Richards, who many will know is the outgoing chair of the CQC at the moment. But CQC sort of recognised that Professor Sir Mike's strengths lie within the kind of health and hospitals sector. He was Chief Inspector for Hospitals for a number of years. So they also commissioned a kind of further review into the single assessment framework in adult social care settings specifically, and they asked the CPA, the Care Provider Alliance, to do that. So that's where all of this work initially came from. It was completed by 7 of the constituent members of the CPA. So that is the list, Liz, on the right-hand side of this slide. Those are the involved organisations. And in this kind of first stage of work, this first review, it took about 4 months. We engaged with over 1,500 providers via survey and through focus group discussions. So we had some really great engagement from the sector. And I should say all of the work I'm going to talk about today has been completed with direct input from a panel of providers who are kind of on our steering group, but also very much involved in producing the work of all different shapes and sizes and service types. And Dan G is one of those providers on the call today. Could I have my next slide, please? Thank you. So sticking with this first work package, which was the review of the single assessment framework, I won't go into all of the recommendations we made, but I've just highlighted a few, and the rest are available on the report, which you can find on the CQC website, and is also linked when the slides are shared. But some of the recommendations we made was to create a reduced set of quality statements. So bringing down that number from 34 to something that feels a bit more manageable. Creating service level guidance for every quality statement, including examples of good and outstanding. So kind of going back to that ratings characteristics style approach. Ensuring that evidence included in decision making has been corroborated. That one was felt very strongly. Making sure that those kind of triangulation processes are happening during inspections where possible. And could I have my next slide, please? Also reintroducing a single point of contact or named inspector for all providers. So it's really great to hear from Chris that that's something in the works. And kind of trying to bring some care provider involvement into inspector training to kind of support understanding for each different type of care service and the people that we support, because we do have a very wide range of services all sitting under one kind of large sector umbrella. So as we say, we are immensely grateful to colleagues in the CPA and our provider panel for their really valuable contributions to this report. And off the back of that report, we then had a second package of work commissioned to assist looking at recommendation 2 specifically, which is creating service level guidance for every quality statement, including examples of what good and outstanding looks like for each service type. So could I have my next slide, please? Thank you. So I should say as well, quality statements, Chloe, is kind of a bit interchangeable here. Quality statements in the past tense, but obviously these are now reworded as key lines of inquiry. So this second work package, looking at recommendation 2, is made of 3 phases. These are broadly kind of sitting between stages of public consultation, feeding into CQC's work alongside work they're doing with inspectors, internal policy teams, and kind of lots of other stuff going on at the same time. So phase 1 has been completed, and that was adding clarity, trying to deduplicate, as we called it, kind of removing overlap from the different quality statements and reducing the number at the same time. Phase 2, we've just finished, and that was looking at the ratings characteristics for each quality statement at Chloe now at a wider kind of sector level. And phase 3 is still to come, and that's looking at what good looks like at service type level. So understanding those differences in what we're going to look at in home care versus care homes versus nursing homes versus shared lives, etc., and kind of making sure that that framework is flexing where it needs to in that more granular service specific way. So could I have my next slide, please? Thank you. So phase 1, this is just a brief overview of the phase 1 feedback when we were reducing that duplication and adding some clarity, trying to bring down the number of quality statements. And a lot of that work really was focused on recognising the limits of providers' capacity, responsibilities, and making sure that the framework remained specific to adult social care. And our roles as opposed to those of commissioners or partners or the NHS and hospitals, and making sure that the language was also feeling more adult social care. So having fewer mentions of things being very clinical or talking about treatment and things like that. We also had some pretty detailed discussions about safeguarding. And yeah, we managed to suggest that a few were removed. We suggested a lot of kind of moving around of different content and just did a wider review of everything we were given at the time. And then that led very neatly into phase 2, which is on the next slide. As I say, that was completed just in advance of the current consultation. So some of the feedback has been incorporated and some of it is kind of still wending its way through. But some key themes in that feedback, again, sometimes reviewing and refining the language, but looking more at kind of the use of the word always, for example. And we had quite a lot of challenge from providers in that initial 2025 piece of work about how do we prove that we're always doing something? How, do we have to log every single instance? It's just quite a challenging word to come across sometimes. So looking at things like that, also trying to kind of recognise the commissioning landscape and understanding that that can be challenging in some areas, and making sure that we know what is within and outside the kind of scope of control of the provider. We looked at increasing the emphasis on real-world impacts on the lives of people using services as well. That came through very strongly from our provider panel, that actually that is something that you can really evidence. That is where the work happens, that is the focus, that's what people go to work to do. And it's really helpful if the assessment framework is kind of aligned with those priorities. So again, it's really great to hear from Chris that sort of 80-20 rule coming into play. I think that would be very helpful. And I've kind of done these backwards, but also looking at adding some clarity between kind of, so we've got our inadequate, requires improvement, good and outstanding, and then we have our compliance, non-compliance, and just understanding where those scales sort of align or don't align. So I think there's probably some more discussion on that one coming. And then we also looked at some kind of specific areas where we think just might need another look, like timely and equitable access and environmental sustainability, and just making sure that the requirements are appropriate to the role of providers and sort of within the regulations, and lots of other stuff like that. So yeah, phase 3, that more granular work at a service specific level is still to come, but I'm sure we'll be cracking on with that in, well, fairly soon. And yes, that's everything, and we're just very grateful to all of our colleagues across the CPA and all the providers who've taken part, both in our kind of wider engagement exercises and on our panel. So yes, that's me. That's our context.
Thanks
for today. Thank you.
And actually, you reminded me that Dan G was involved in that work. Was there anything you wanted to reflect on about the pieces of work that you've helped us with through the via the CPA route, Dan?
Yeah, I think the key part was to make it as clear and usable as possible, and that removing of the duplication was the key driver from being a provider, because obviously we want services, managers and staff teams to be able to be very clear and being able to show that. Conversely, we need colleagues from when inspectors coming in to be able to be clear what they're looking for and being able to use the guidance. So I think that really helped being to demystify some of those, but also that next phase where it says now with the more details, which I think is what the sector's looking for. And I take Chris's point on at the start as well, where he talked about actually it can't be too prescriptive, because actually we do need services to evidence what they're doing and the outcomes for the individuals they're supporting. But I think it's giving the sector more information they need and have been asking for. Thank you.
Thanks. I'm gonna, before I go into our key areas of chat, because there are some things we want to talk about in response to Chris's presentation, I'm going to have a little look at the first batch of Q&A. So Philippa from Hampson's has a good question. How does an RI provider with a breach who has done lots of positive work get CQC back out to inspect and confirm the breach has been fulfilled? And I think this might be a theme on a number of questions, actually. I think a few people are interested in. Everyone's delighted that you want to get out more, Chris and Ro. How do they get you out to evidence that that they've responded to the previous inspection and sorted out breaches?
If I start off and then Ro, do you want to come in after that? So we'll always be keen to see progress on where there's been an issue significant enough to represent a breach. So one of the things I want to do with our emerging work on having like relationship managers and like named inspectors is that ability to be able to keep the inspector updated and the inspector updating them on other bits and pieces that are coming around the corner too. So that'll be one way where we will hope to be able to get that better understanding around what's happening with each provider and what that means locally, and keeping us in the loop on that. Clearly, we're always having to make decisions to prioritise resources. Like anyone in adult social care, we have limited resources. We can't go out as much as we want all the time. What I am seeking to do is to, with the resources we've got, allow colleagues to get out more often, which is of course why they come to work. That's what they want to do, Liz. That's why they're there. They really want to sit behind a computer screen. They want to go out and see care settings and meet people. So all of that work is designed to give us that capacity to respond as effectively as possible to the kind of cases that Philip has mentioned. Ro, I don't know if there's anything you wanted to add to that.
I mean, I think you've covered most of it. I suppose the only thing I would say is there's some thinking going on around what the scope of our inspections looks like, and whether there are things that we can do in certain circumstances that might allow us to be a bit more flexible. So I suppose not all breaches are equal, and some things might be multifaceted, covering lots of areas. Other things might be unique to one specific thing that could be quite easily evidenced through a submission of evidence. There might be different ways to demonstrate that compliance. So I suppose there's just a little bit of thought about whether there could be a slightly more flexible approach to how we might address some of that, rather than always having to sort of wait for that longer site visit, looking at more things. But certainly something we're thinking about.
Thank you. At that point, I guess, I mean, I think people perhaps underestimate the challenge of creating capacity amongst our inspector colleagues. So there's the opportunity cost, isn't there, of some of the stuff that has occupied a huge amount of people's time, be that the technology challenges, the implementation reality of the previous arrangements. So I guess if you can streamline some of that, that will free up a degree of capacity across the team.
Absolutely. Really good articulation of the issue, Liz. Absolutely.
Yeah. Okay, so let's pick up a couple of the topics in your very helpful slides then, because I think the kind of collaborative approach and the inspecting for good is something that the sector's been seeking for a little while, I would say. It feels like it's been quite a long time. I'm trying to work out when this all started, but let's look to the future. So Dan R and Dan G, I'm interested in your reflections on Chris's presentation, and thinking first of all about the ambition to be a collaborative regulator and to be inspecting for good. From your point of view, from the different organisations that you work in and the services that you run, kind of how do you feel that's going to, what would you be looking for? How would you want that to be manifested in the inspection experience of your colleagues? And shall we start with Dan R?
Thanks, Liz. So how to approach that? So it's a really positive presentation. Then really good to hear some of that stuff, and really good to hear that kind of return to inspecting for good, and particularly that sense of kind of going back out to kind of those aged good ratings. So that's all good stuff. It's really hard to move on from some of the questions that have come in though, and that particular one about, so it's getting the balance right, isn't it? I think sometimes between more numbers and returning to good against some of those aged RI ratings that some of us have. And I think the other thing is also being confident that we're going to get a kind of consistent approach. So I really like that idea that a kind of shorter inspection, a kind of revalidation of good, but then you also want time to be able to evidence and demonstrate outstanding practice and innovation and all of the things that go along with that. So hopefully a return to a more collaborative approach allows us to have some of those conversations. I think there's a real need to rebuild some trust, because we've been for quite some time in a position where I think we've been in that risk-based position. And because inspections have been based on risk, there's a sense that people are arriving looking for something not to be good rather than looking for something to be good. And so I think that undermines some of those more kind of open conversations that historically we've really sought to have with inspectors that we know. It's really important for providers to to know where their issues are, and to know what's going well and what's not going well, and to own those issues, and to be able to be confident that we've got plans in place to address those. But in a sense, you need that trust, don't you? You need that collaborative approach to be able to have some of those kind of really, really honest conversations. And I suppose the other thing is, I think one of the other experiences that we've had is of inspections where there's a huge amount of paperwork and evidence behind that. And it'd be really nice to get back to a place where we've got inspectors in the home looking for good, and recognising how a home feels, and the confidence of residents, and the quality of relationships, and the way colleagues respond in the moment, rather than sometimes it feels like we spend many hours and many weeks uploading many documents after the event, and having the inspection post-inspection. I suppose, and maybe the kind of final point on all of that before I stop talking, is just thinking a little bit about getting some real consistency back to how some of that feedback works as well. So I think that's a really important part of the collaboration. And sometimes we see verbal feedback given at the end of inspections. Sometimes we see verbal feedback given a week or two, or maybe even 3 weeks after inspections. And we've had one example not that long ago of receiving a draft inspection report without any verbal feedback at all. So you want to feel that you're in a conversation, I think, is probably where I'm getting to with that.
Thanks, Dan. Danji?
Yeah, I think building on what was said there, I think what we've heard from Chris today is quite familiar. So it's referencing back to some of the things and processes we had in the past, which I think is familiar to CQC, will be familiar to registered managers. But I think that the point I would make, and it links into your point earlier as well, is about preparing for an inspection. The sector has a lot of managers that may not have been inspected since they've become registered. We also have a lot of managers that haven't been inspected for a number of years for the points and the reasons that we know. So I think there's sort of like an extra challenge for the inspector in that they need to build the trust and confidence, as Dan said, but also acknowledge that they will be across the table, the screen, and with managers that want to show a good service, want to show how well they've done, and their teams have done, and the outcomes for the individuals, but actually they are nervous. And I think with what's happened, where you've had to respond to risk, it's great news, and that you're returning to that inspector good, but I think that trust needs to come in, and what the sector needs is inspectors that acknowledge that, because I think if inspectors are the ones that are in the driving seat, that they can put the managers and the staff team at ease. So I think it's a side challenge, but it's a really important one, that it comes alongside being a regulator, that the inspector is in the position of power. And I think that we need to support out the whole sector to be responsive to that, but equally be able to showcase things that managers and services and their whole teams do really, really well. I also would like to see the use of the professional judgment of the inspector, because as Dan said, the sector is being asked to upload hundreds, sometimes 500-700 documents post-inspection, and we can't tick every box. And so I think, that professional judgment, that conversation, that returning to a place of where you've got a portfolio management, where both the inspector knows their group of services, the client group, the people they're working with, would be really helpful. So I think that the journey can only be positive. Thank you, Liz.
Thank you. And actually, that is a good point, Chris. That reminds me of some of the things on a slide. That point about kind of training both sides of us. So I think getting our teams prepped is really key. And that point you've made about managers may not have had an inspection, that is actually really, really valid. So yes, and thinking about how we can get a provider perspective into the training of our colleagues as well. So I don't know where we are on that. Have we got a plan for provider input into CQC inspector training? Have we If we move on that.
We're doing quite a big review of some of that, Liz. But yes, I'd expect to see that. I think that would be helpful, and likewise, you know, the more we can help be involved in how training's formulated and positioned, the better too, Liz. So yeah, it'd be something we definitely want to take forward. Do you want me to come back on a couple of those issues just to sort of comment on them or not?
Yeah, sure.
Yeah, look, well, really thanks, Dan's plural. Really helpful. Look, I agree about the paperwork point. You know, like I talk about the 80-20 rule. Look, I know so much more focus for me on observation, what that looks like. I'll give you an example. When I was out on an inspection last month, you know, saw some amazing personalised practice. So you see that, you then look at the specific care plan of the individual that was being supported, and that gives you enough reassurance because the two tallied. But rather than look at a load of care plans, then go out and do the observation and then ask for more and more, actually focus on that observation. What does it feel like? That sense of what the professional judgment around, you know, what good quality care looks and feels like in a setting is most important to me. I think the new assessment framework will help on that, because the old one required so many, in a sense, data points, and the more of those that you have in, whether it be evidence, you know, we removed evidence, you know, scores at each one of the 34 quality statements. The more of those you have, the more it drives the need for evidence to document that, and that creates that you know, if you're not careful, that industry of document creation, because people are trying to sort of verify behind those judgments on those individual scores. And I think we made it way too complicated with the number of kind of scores you would have to get to a rating. And I think that probably drove the demand for documents and stuff. And I think then you lose the central core of what we need to do, which is understanding the quality of that care based on what we can observe.
Yes, the more I reflect on your description of the behemoth that seem to exist, it's quite remarkable, actually, Chris. So onwards and upwards, let's have a look at a couple of the Q&A. Anonymous attendee says, a clarification: if a service is inspected next week, what assessment framework would they be inspected on? I'm assuming the existing one, but you might want to clarify.
Yeah, it'd be the existing one. It's unlikely that, because we're still only piloting the return to good methodology, that would be on the existing set of quality statements, but a reduced list, as I discussed. But currently, it's the existing framework until we've got the new one tested.
Thank you. And Agatha asks for a bit more information about more insight on outstanding, also around technology. So I think it's quite important to clarify here. I know that you made a commitment to us at our trade association meetings around seeking to publish more information about outstanding ratings that you'd found and some of the best practice that you were observing. It might be also worth clarifying around the fact that when you're talking about technologies, that doesn't mean everyone should necessarily go and buy them. I think that might be a helpful thing to just nuance a bit here. Yeah,
no, totally. Look, on outstanding, and I'll just one thing that if I say Dan mentioned, and I'll cover all bases when I know that Dan mentioned, was the we have actually seen an uptick in outstanding early signs. So since we changed the prioritisation and not was looking at going to a wider range of providers, not just ones where we've got an immediate risk that's come across our desk. As a result, we're seeing a notable uptick in the number of outstandings that are being given, which I think is really, really positive. Not least, it helps culturally in terms of that looking for good idea, because if you're looking for good because you've seen some recently, it does help. Whereas if you only ever go into problematic areas, then that's harder to do. So that's already helping, and I'm really, really pleased about that. We're planning to sort of revise how we talk and share what we're finding with the sector. So I don't want any of this to be sort of hidden. Where we're seeing great practice, we want to do our bit to really share that. That's probably the most important thing we can do in terms of being an agent of improvement, Liz. So we're looking to revamp how we do that. Crucially, we needed to make sure we had a decent number of inspections going before we could do that, because we wouldn't have had anything to communicate. But now actually we're getting to a level where I'm confident that we can really go out and be clear around what good that we're seeing. On technology, a couple of things to look out for. We'll be coming out with a position statement on artificial intelligence soon, which I know a lot of people talk to me about. Again, what I want to be here is a permissive regulator. So one that encourages and facilitates the use of technology, but I'm not prescriptive about what technology that is or isn't. Technology in and of itself doesn't make life any better for anyone, but what we're interested to see is how people are using technology to help people meet the outcomes they want to achieve and improve their lives, and being really clear around what that looks like, really good governance around it so it's managed effectively. You know, the minute I'm prescriptive about technology, that technology will be out of date anyway, and not of old to do it. But what I will be, in a sense, prescriptive on is it governed well, and how are you showing that it makes a difference to people's lives? And if we keep it as simple as that, then I think that's the way we can create an environment where we're encouraging it, showing people where that's worked really well and showcasing it, but not getting in the way.
Yeah. I wouldn't go down the line of trying to recommend any technology, to be honest. I think that's very wise. There is such a lot of fantastic stuff out there, but there's also it's important to make sure that we are sharing our learning and our understanding. The maturity question is always relevant, isn't it? And actually, while we're talking about technology, there's a question from Lee Horton, who's asking about the portal. Any update on the portal, or do we need a whole different webinar for that?
Yeah. Well, just on wider technology, so it's a good question that we need to get the whole technology offer right for providers, right for colleagues. So we're doing a big bit of work to in a sense redesign that. We need to do that in sort of lockstep with the assessment frameworks. We obviously need to build the technology that represents the new assessment framework, registration process, and etc. Part of that work is obviously on the portal. The IT is a inhibitor both for providers, which I totally understand and will always apologise on behalf of the organisation for the challenges that's created, but also the inspectors who want to make something that works for everyone, that allows us to be as efficient and effective as we all want to be, and technology that helps us, not hinders us, Liz. So that work is ongoing and going at some pace. But again, I stress the importance of us trying to get that right with proper testing and evaluation.
Thank you. Any sense of timescales ish?
So the kind of proof of concept being developed as we speak, and some of that's already really complete, and we're looking to. I'm hesitant to give exact details until we've looked at how some of that's going, but looking at certainly end of 2026 for us to be seeing some elements of that new approach being implemented. Liz, we'll be keeping colleagues updated as we get through certain checkpoints. So rather than announce it all in one go, we'll do it on a milestone basis so that we're clear that we're assured that we reach something safely with the right testing and engagement of colleagues across the sector, and then moving on to the next one without rushing ahead and getting something that doesn't work, which was a problem last time, as you know.
Yeah, I think that testing is really important, actually. I'm just thinking that might be a thing where our colleagues across the Care Provider Alliance might stand up again.
Definitely.
The lack of testing was a real challenge.
Absolutely.
Okay. Let's move us on to rebuilding relationships, because I'm seeing quite a few questions in the Q&A about consistency, fairness, transparency, and I know that at the start of your presentation, Chris, building relationships was up there as part of the collaborative approach. So just thinking from Dan and Dan's perspective, from your point of view, thinking about the things that Chris has set out, and that sense of your teams on the front line, seeking that kind of consistency and sense of fairness. What are the things that you would be, or you are, saying to your teams in terms of how they're approaching getting ready for inspection, but also how they are supporting that expectation from inspectors, that they have of inspectors about consistency and fairness. Is that something that they're experiencing, or is that something that you are hearing that they're needing to challenge back and kind of seek clarification on? It at the front line, are you seeing a sense of better consistency, better fairness, or is it in the balance at the moment? What's the experience from because you've both got lots of services across the country. Who wants to go first? Dan or Dan? Dan G or Dan R?
I'm happy to go first, Liz. Thank you. I think for us as an organisation, it's too early to tell. We've not had that many inspections. The ones we have had haven't been consistent, though. So I'm almost contradicting myself there in that we've not had many, but they weren't consistent. As part of the nominated individual network, we talk about this a lot. So I think there's still inconsistency in the market. But I think the important thing is, and your point was about preparation and supporting our teams to be ready for inspection as well, because if you're prepared and ready for inspection as a manager and a team, you know the regulations, and depending on your role, you wouldn't want, say, support staff to know all of the regulations in great detail, but you would expect a registered manager. I think if they know the regulations and know their services really well, that helps them challenge the inspection at the appropriate times. As Chris was saying, if things aren't going well in the inspection, ask those questions there. So preparation is key for everything. And I think our role as an organisation is to support our managers and frontline teams to be prepared for inspections. Share the good practice that comes out, share the learning from CQC's published reports, share our internal learning from our quality assurance governance processes, so that we can make sure that knowledge and practice is being built. I would also say that I think it's really important that teams and the people that we support can share their stories and show that impact of individuals' lives and the difference we're making, but also meeting the individual needs to the inspectors. It's a really complicated process, the inspection, and I think if you can support teams to be prepared, and that's that preparation I said a moment ago, that's what will be helpful. And to be confident and to be proud, have pride in what you do. I know when I'm visiting services, everyone is proud about what they're doing, from the support staff to people who support, explaining what they've done. It's done with a smile. It's done from a place of confidence and pride. And I think if that can come through in that observation part, I think that helps. I would like to see the return to goods being rolled out, the more consistency. And I liked that point that Chris said, and you said earlier about the training, because I think we talk about co-produced training with the people that we support often, but actually I think if you think about it from a regulator's point of view, some co-produced training where providers can help CQC inspectors be trained as part of their induction, that might be helpful, because it's nothing more powerful than hearing from individuals themselves how it feels to be inspected, how it feels to be on that end, to change your own practice and learn from that. And I'll hand over to Dan R now to add anything that he may like to.
Thanks, Dan. I'd say, yeah, I mean, I think you've probably said an awful lot of what I would say, obviously in slightly different words, but I think in terms of thinking about that kind of consistency and being prepared for inspection, I think the fact that we have got used to not having such regular inspections means that certainly at Anchor and certainly in previous roles, and I think most colleagues that I've spoken to have got a pretty solid internal kind of QA process, which in a sense has almost become the benchmark for our own sense of how we're doing from a governance perspective in the absence of kind of routine external inspections, because we've got some age inspections that are 4, 5, 6 years old. So you have to rely on your internal processes for that. And to a large extent, that then becomes your your practice ground, your training ground for the true inspection. So you've got your basics right, you've got your medication practice and your staffing and your safeguarding and your IPC and your care plans. But I think then in thinking about when you have an external inspection, it's the stuff that we would all automatically know internally, but we have to externalize for people that are coming to the service afresh. So I think it is, isn't it, about thinking about how are we going to demonstrate that impact? How are we going to have to hand the resident and family voice and what the service kind of does for them and means for them? How are we going to bring compliments, survey results, complaints, family meetings, you said we did, all that stuff? How do we make sure that we kind of bring that to life and use that through an inspection and present that in the right way? And then going back to I think part of the beginning of this question was around what are we seeing in terms of consistency of practice? And I think that there's a way to go until we get to a place where we can feel confident that inspections are consistent. I mean, I'm not necessarily talking about kind of what people are looking for, but certainly I'll give one really simple example.
Oh no.
Last 40 bed.
You dropped out a little
services.
bit there, Dan.
Am I back?
Yeah, you had us on tenterhooks with an example.
Yeah, okay. So I'll give a really obvious example of two services that have been inspected over the last 6 weeks. Both 40-bed services. One was inspected by one inspector for 1 day, and another service was inspected by 3 inspectors and an expert by experience, also for 1 day. But four times as many kind of people inspecting the service. Now, asking the questions, neither inspection was triggered by an identified risk or a concern. There were a kind of age inspection. And we can't understand the rationale. Now, maybe there is a clear rationale as to why one home would have 4 inspectors and one would have 1. But in the absence of a kind of explanation about that, you're left feeling that it's a kind of an inconsistent process. So I think it would be really good to have consistency or transparency where there isn't consistency. I mentioned the feedback point earlier on. So consistency and timeliness of feedback would be great. And I think those points would go an awful long way to that kind of rebuilding trust and being able to build those relationships that we're talking about here. I see Chris is gonna tell me why we've got different inspectors in those 2 different places.
No, that's not what I was going to say. But anyway,
what a shame.
I thought you were going to give us.
Well, no, the consistency doesn't always mean doing exactly the same thing, does it? No. So then, and I don't know the example, Dan, for why you do that. We have experts by experience. We don't have the resource to do that for every inspection, but I still think it's important that we have those regularly because it gives us a good cross-setting. Sometimes we're doing it because we're developing a new inspector, and I'm really keen that inspectors really learn the most by shadowing inspections, not in a classroom, if that makes sense, Dan, in terms of doing that. Should we be clear about why? Yes. So we'll work on that. Should the feedback be consistent? Yes. It needs to be timely because it's feedback that drives improvement. A report doesn't drive improvement. The feedback does. When I've been on inspection, you feedback on an issue there and then, and actually the provider's often taking the action to deal with it there and then, and you can see the improvement in front of you. That's great. I would say, isn't it good that you've had 2 inspections that are based on the age of the rating? To flip it that way too. That's good. That's good to hear. On consistency, look, consistency is not something you go through. I want things to be consistent. You want things to be consistent. And if I just wish it happens, then it'll happen. It's not our culture, and consistency works. There's the same with the consistency. And if you're a care provider like Anchor, you'll have some bits that are more consistent than others in terms of care. It's around, and I suppose that's what I'm trying to get to with the assessment framework. How do we develop a framework that helps drive consistency? So ratings characteristics is just as helpful for, say, the inspector as it is for the providers. And you've got a joint set of things that you're working to help drive that consistency. It'll take time. I'm not going to sit here and say things are going to be more consistent straight away. Will a regulator ever be 100% consistent? No. Do you always need to strive to be as consistent as possible? Yes, and put in the tools to do that. So that's definitely the sense that we want to go in. Linked to that will be, we are strengthening our quality assurance and quality control processes that are linked to that. On your point about, what you do as a provider to assure quality, I think that's important whether you've got regular inspections or not. Ultimately, an inspection is a point in time. If you're running a care provider, you're going to want, even if we were going out every year, you'd want that, as you've said, Dan, you'd want that real-time sense of assurance yourself as a leader within that provider around the quality of what you're doing. We are not, we are a regulator, and we're part and parcel of that assurance process, but we're definitely not the only bit. And I think, the quality of how well providers do that themselves, because that's a 365-day a year exercise for a provider, and we're not going to be coming in that regularly. You're probably quite pleased to know. So I think that's, we're really we're different sides of the same coin, I think, in terms of the quality assurance process would be my reflection.
And I think actually, going back to our training point, and Honor was going to tell me where we'd got to with that plan. I think, I guess everybody is in this bit of the world to make things better, to achieve good things, to make sure people are well looked after, well supported, well enabled, as independent as possible, safe, happy, living their best lives. That's why the vast majority of people work in this sector, isn't it? And I guess some of the, bringing that experience of the inspected to the inspector is quite powerful. So I think that was part of the rationale, I think, Honor, when we were thinking about that offer. So I think there's a plan. I think there was a plan.
Yeah. Do you want me to come in on that quickly?
Can you remind me what the plan was?
Yes. So the plan is still kind of under development, but at the moment we have this week got some CPA colleagues going to actually sit in on a day's training for inspector induction, and just kind of get a sense of the room. So I think we've got 3 people going, 2 of which work within CPA organizations, but also within provider organizations. So kind of bringing the policy brain, but also the provider brain. Not that they're necessarily mutually exclusive.
No,
but
indeed.
yes.
And some inspectors have been providers. And
yes, indeed. So yeah. And we are, that's kind of still under development.
Okay.
In terms of what we're doing further.
Thank you. So we've got about 15 minutes left, and I am conscious that the current consultation that's open is asking people to consider the latest proposal of ratings characteristics. So this is all about us having a shared understanding of what good and outstanding looks like. I don't know if Dan have had a chance to have a look at what's in the consultation. I've got any observations so far. It is an endeavour. You've got to be ready to read it all and then put your brain in and then think about what you think about each of the characteristics for each of the quality statements / Chloe's. And it is really important, everyone who is on this call, if you can have a look at it, I think your feedback will add value to the endeavour to reach a new assessment framework that really clearly articulates what we all think good and outstanding looks like, and what we think isn't, what we think is requiring improvement and is inadequate. It is important that everyone has a look. Have you got any reflections, Dan, on what you've seen so far? Any messages for our participants in the webinar?
Liz, can I go first? I mean, I think it's just incredibly welcome. It's probably one of the most kind of positive things I've seen in an awful long time, and that opportunity to have a real kind of shared practical understanding of what kind of good and what outstanding looks like, and not just kind of kind of abstract ideas around that, and something that we can kind of coalesce around is really, really important. But I guess it's going to be an ever evolving work in progress, because kind of services change, and when we're having those conversations about kind of what does innovation look like and how does technology get brought into this, the world's a fast moving place, isn't it? So I wonder how long they'll stand still for, or maybe they'll be clear enough that they'll kind of stand that test of time. I'm not sure. And then I think the other thing for me is just thinking about how different areas of kind of those descriptors and the different kind of key lines have got the potential for overlap as well. So how do we get the right things in the right places, and either we don't think that we're kind of double counting things that are great and thinking we should be outstanding, or on the other side of the things, we don't feel that somebody else is double counting something where there's a challenge and we're getting kind of overly penalized for that stuff. So I haven't gone through them with a fine tooth comb yet, but that'll be one of the things that's in my mind when I do, is how does that, how do we make sure we get everything in the right place?
Yeah, well, you have that joy to look forward to, and my memory from looking at a previous iteration is that this iteration has less overlap. But Ro, you wanted to say something.
I was just going to say, I'd really encourage both you, Dan, and everybody that's listening in today to really do tell us what you think about those areas of duplication. I think we're aware of some areas where that still exists, but prior to putting out this draft, we didn't really have a clear consensus view on that. So we're really seeking to get that through the engagement that we do and to build that consensus position around that. So I suppose some of the areas that we're particularly interested in are those Chloe's around sort of system level or partnership working, and that those Chloe's that fall across safe, responsive and well led in relation to those. We've got the sort of partnerships and communities, we've got the one around care provision, continuity and integration, and we've got one around safe systems and pathways, and we're sort of hearing bits that there's still some duplication across those. So really interested in feedback around that, and feedback again building on what we heard from the CPA about the equity in access, Chloe, and whether or not there is scope and opportunity for that to be combined with the one around equity and experience to build a much stronger, more robust Chloe, rather than having those spread out. And so really encourage some of that feedback around where you think there's areas of duplication. We're really keen to emphasize that this is very much a draft document and we expect it to change. We expect the final version of this to look different by the time we get to publication. I suppose the other thing about the sort of point that Dan made around the sort of future proofing of this is thinking about this as kind of the top level articulation for adult social care, but thinking then about that guidance that will support this, and that being something we really want to change on a regular basis and really keep pace on a sort of rolling basis with changes in the sector, changes in external or best practice guidance, and how do we keep that really up to date so it's useful for the whole sector, but for different service types within that. And the other final bit I'd sort of say in terms of plugging for feedback is please do think about that distinction between good and outstanding, that we're sort of, is that clear enough? Does the outstanding bit really feel like outstanding, or is there more we can do to sort of pitch that at the right level?
Thanks, Ro. My memory is that it's relatively future-proofed.
Yeah, I mean, that's the intention, that this bit would be fairly future-proof because of the need to consult to change on this level of stuff at the framework level. And so we would want the guidance to be the thing that we would be much more agile with, although accepting if we need to make changes to the framework, then we'll do that.
Okay. Dan G.
Thank you. I was just going to say it is on a journey, and obviously over the different versions you can see the feedback is being taken on board and it is being adapted. So I guess my plea would be the same as yours, Liz, to everyone else, is please find the time to read it, because it's easy after the consultation has closed to sort of say, give feedback then, but actually it's worth as a sector being that strong voice, giving that feedback. We've asked for this change as a sector, so I would ask that everyone finds the time to read it and give that feedback with that view, because we are all here to make a difference. So I would please ask people to give the feedback.
Yeah, I agree with that. I mean, we did spend quite a lot of time saying we want some ratings characteristics.
Yeah.
So, you know, we really did. And now we've got them. So
it's a shared responsibility, isn't it, to go back now and give that feedback?
Yes, it is. And they are definitely a better read than they were a couple of months ago, I would say. And on that equality of access, so much of that is beyond our gift. I do think that it's got lots of challenges for providers. It's a system-wide thing, I think, from my recollection of looking at the different ratings characteristics for that. It seemed to be back to the point that Honor made a while ago about the scope and reach of individual provider organisations' responsibilities and power. It's not, some of that's just not within our power. Right, we've got a few minutes left, and I'm going to go back to the Q&A because there are some questions that we can answer quickly, and then there are some questions that we can't answer quickly. So there's a few questions about the ambition on reports, getting reports out more quickly by keeping them brief. How will you balance the pressure to rush reports out with quality assurance and around accuracy? That is a good question.
Well, for a start, I certainly don't want to rush them out. I want to get them out in good order. Look, there's a balance here. You know, we need to get out and getting the feedback loud and clear that we need to get out more regularly and more often. I think the way that we write reports, that they can be quite repetitive and they're at a length which, the key customer for the reports is the public, right? The bit that and if we know they're not reading them, then that's not, a particularly good use of anyone's time. And what we're then doing is doing a few at a very lengthy sort of involved rate, but not getting around to lots of other people at all. So look, there's a trade-off we're having to make there. There's a balance. We don't want to rush them. In a sense, if we can make a lot of those processes sort of slicker, more efficient, probably sort of shorten, remove some of the duplication in the report, we've got more time for the quality assurance and the quality control, not less. So hopefully that allows us to get things out in an ordered way, but at some pace. I think going back to Dan's point though, the key thing is getting the feedback done really in a timely way, ideally as you go along, because that's when you can get the immediate change. Shouldn't be waiting for a report. It's clearly not good practice to be able to wait for the feedback. When you first see the report, that's really frustrating for the providers. I totally understand that. We don't want to be doing that because we want to see improvement and the feedback taken on as soon as we give it, because it's important stuff, right? So that's the other element of this. But yeah, certainly don't want to rush things, and certainly looking at different ways of us building the quality control and quality assurance process. I think these changes give us more room to get some of that stuff right.
Thank you. And another question around lead inspectors. So Paul Moore says, thank you, Christ. I think that might be a typo. Great to see the further evolution of adult social care assessment framework. Lead inspector for each provider is great to hear. Will these be at provider/registered service level or at corporate level?
So it depends on the provider. So we have got a corporate provider team that we're looking to expand, actually, to have more providers covered by that, where we have a relationship manager across homes or registered settings for home care, etc. But even when that providers aren't as big as that, we will seek to build those portfolios. I mean, in a locality, if there's sort of a number of homes in a locality, we may well group those under one lead inspector. Sometimes we might not want to do that because the services are very different. We'll take a nuanced view on that. But we know when there are providers that deliver services across multiple sites, for example, the leadership in that particular registration is important, but also the work that might happen with, say, the quality team or overarching governance is also important. So we will have the ability to build those relationships at provider level where we can, but we'll probably be doing that on a case-by-case basis, depending on the size of the provider, the range of the services, and so forth, Liz.
Okay, so you're going to flex it.
Mm-hmm.
flex it intelligently. And one final question I'm going to ask before I ask for a couple of final reflections. Marina Martin says, regarding observations, what does that mean for domiciliary care providers? So your 80-20 rule in home care.
Yeah, it's harder, isn't it? You know, we know that that's more difficult, but you'd still be observing about how colleagues interact with one another as well, and when speaking to people that use services. So you know, it's more difficult because of the dispersed nature of domiciliary services. But I suppose the key takeaway I'd keep with that, which is common to all frameworks, is a focus on what makes a difference to people being part of the 80%, and the 20% being those things that support that with good governance, but it being that focus on what makes a difference to people particularly around personalisation and safety, which is really important in home care. And then a much more refined focus on governance, in as much as it supports that personalisation and safeguarding. So it's a different mix, it's a different set of challenges to regulate and inspect and of course deliver home care than it is other areas, but I think the principle still applies.
Yeah, well, and maybe thinking about the technology available to gather feedback and to get input from people and their families actually presents you with quite a wider range of opportunities than perhaps previously had. Right, there are loads more questions. Loads. I think I'm going to have to take you up on your offer to have a look at the list of questions we've got and give some feedback.
Good to do that.
No worries.
There's loads.
No problem.
And there's some great suggestions actually as well.
Really
some
helpful.
Good ideas in here. So I'm going to leave the Q&A where we are. I've also been asked by our hosts to give a shout out to Krona, who we didn't hear from, but their video will be online if you want to see who sponsored this, because sponsorship helps to make the magic happen along with all the people that do the hard work. And just in a couple of minutes, I'm going to ask Dan and Dan for any final reflections on what we've heard before we say goodbye to our CQC colleagues. Oh, and our CQC colleagues can also remind us about any other consultation events. So, Dan G, any final reflections? Think about where we were a year ago, maybe.
Yes, I would say we have welcomed and been championed as a sector these changes at CQC. So thank you for that. And I think now's our chance to, as I said earlier, use our voice and review the draft consultations out, give our feedback, because that's the foundations of building the future together to make a better health and social care. Dan R.
Thank you. Yeah, listen, I think some really positive messages today, and I really hope that we can move at pace. And Chris, you and colleagues can move at pace to deliver against those. Returning to inspecting for good, got to be a great thing, hasn't it? If we can get that right, and with sufficient kind of time to observe good practice and innovation and gather all those things in, brilliant. If we can rebuild those relationships and be confident around consistency and transparency and feedback, fantastic. And if we've got a shared understanding of what good and what outstanding genuinely look like, then we'll be in a whole different place, I think, in terms of moving forwards, kind of together on this front. So I'm keeping a very positive mindset. And yes, let's feedback.
Yep. If you're not in it, you're not going to win it, are
Absolutely. Yep.
So I'm also quite excited for the CQC's refreshed role in terms of advocacy. I think that could be really quite helpful given where we are with things. So over to Chris and Row, final thoughts and any last minute things you want to say in terms of the consultation before colleagues leave us.
I echo those comments and thanks for everyone that's contributed so far. Look, I know that there's a lot to get through, but don't feel you have to get through everything. There might be an area that you're particularly interested in and focus on that bit. You don't have to look at all of it. Some of it will be sort of cross-cutting anyway, but if you appreciate how busy people are. And so, even if it's one element, one of the Chloes, have a look at it that way, so that we get that range of opinion, but we want to keep hearing it in a way. you know, the more it changes, the better, because I want to get it right. But I also wanted to take the opportunity to thank the team that have done this. When you do something like this, there is a multitude of different views, sometimes completely opposite views on what this looks like. So I think the team, both the CQC team and CPA team, and special mention for Honour, have done loads of work together on this, and I think it's a really good model for how we need to work together. But I know a lot of work's gone into it, and it's you can't please everyone all of the time. So I think they're doing a really good job balancing all that out.
Thank you. Right, we're at time. Thank you, colleagues, for your time and input. Really, really helpful. Thanks for the slides, Chris and Honour, and thanks to everyone who's joined and your engagement and your participation through the questions. We will send them over to the CQC and get a Q&A onto the website, along with this recording and the info from Krona. So this will end our participation, gang. We end the webinar and you all go off to do your next jolly meetings. Have a great rest of the day.
Thanks a lot.
Thank
Thanks,
you so
Liz.
much.
Cheers
Thanks,
then. Bye-bye.
everyone.
Thank you.
Thank
Bye.
you.
Bye. Bye. Bye.
Cheers.
Take
Thanks.
care.